19.
And you're like,
Oh, man.
Holy 19.
All right. The last section for most of you seniors.
18 days till graduation. Yeah. 18 days too long. No. LOL.
Ow. All right, page 404 is where this is. Are we filming?
Yeah.
Good? All right, first of all, is it better to have more psychotherapy? Does that help?
Yes.
There's been some measurements that scientists have done to see the more therapy you go to, what are your results? So here's a graph showing percent improvement on the left versus number of sessions here. So as you notice, the red line is objective measures. That's an objective thing is like a test, a survey, or some. Actually, wouldn't be a survey, but it would be some sort of test. You'll take a bunch of objective tests tomorrow that try to help evaluate if you have various mental disorders. But on objective tests, after 2 sessions, patients tended to do about 20% of them, or were about 20% improved, or about 20% of them improved some, one way or the other. And then, according to patients' own sense of improvement, in 2 sessions, maybe 40% improvement. So just a few sessions does help. The more sessions you take, and here it goes all the way up to 52 sessions is a year of therapy if you're going once a week, and 104 sessions is 2 years of therapy. It seems to help the longer you do it, but you see there's a leveling off there. The improvements aren't as great later on. It looks like improvements tend to go up significantly through 26 sessions. That's, half a year there. And then they kind of level off, but still go up some. So this is based on a summary of 15 studies and 2,400 clients. It's a pretty big study. It's also kind of expensive to do. Imagine if you're doing 104 sessions at, $100 a session. I don't know how much psychologists make, but probably $100 an hour for a professional like that, at least cost. So sometimes you got to factor in the cost too. But some gain is evident there. You need to know this phrase, the therapeutic alliance. Bond of confidence and mutual understanding between the therapist and the client. So you have a therapeutic alliance between you and your professional. And what that basically says is you're both in this together. You're working toward a goal of getting better. The therapist is working toward the goal of you getting better. There's an alliance there. Both people have to function to get it to work. That's a term they go over in the reading a few times. What treatments work the best? Well, for depression, it seems that cognitive therapy works the best. You remember what cognitive therapy is? Sitting down with the therapist and discussing things. And in cognitive therapy, the therapist will usually say something like, you don't have a reason to be, you shouldn't be as depressed as you are. Look at all the good things that are going on in your life. And look, you have your kids, and you have your health, and just so on and so forth. And the cognitive therapist often talks through your problems with you. So that seems to help depression. Now, this is the type of therapy that works the best. They're not talking about drugs at all here. Drugs are the biological treatments, and that's separate. If the drugs aren't working and you are depressed and you're doing therapy, what type of therapy works the best? It seems that cognitive therapy works well for depression. For anxiety disorders, behavioral therapy and exposure treatments. Do you remember what that is? Can you give me an example?
When a therapist brought, someone who had a phobia of snakes or spiders, and then they gave them a virtual test, and
That's
the spiders were everywhere.
A person that has anxiety, exposure treatments usually seem to help them. Yeah. If you have agoraphobia, exposing you to the public, slowly at first, and then more often later, seems to help. Anger and impulsive violence, cognitive therapy for that. Health problems, cognitive and behavioral therapy. I'm not sure how they're defining health problems here. I have to read over that in your book tonight. Child and adolescent behavioral problems. Behavioral therapy works good for that. And finally, schizophrenia, family therapy works well with young adults. Get the whole family involved. So again, these are if you're going to choose something other than biological treatments for whatever reason, these are the therapies that seem to work well. So it's important that you follow up on these patients and see how many are improving. An example of an experiment to see what works the best is you take 400 people with depression and you have 100 of them do cognitive therapy, 100 of them do behavioral therapy, 100 of them do some sort of exposure treatment. You give them a whole different types of treatments and see which one has the best success. And, maybe a year later, go back to all the patients and see if their symptoms persist and so forth. So this kind of work has already been done to see what type of treatments really work the best. It's not always just the type of treatment. The qualities of the client are very important. The qualities of the therapist are very important. Is your client motivated to change? Some people just can't be helped. If they don't want to change, if they won't change, if they're belligerent about it, it's often hard to help someone. The qualities of the therapist are important. Some therapists are better than others. And so the combination of the two, which again we call the therapeutic alignments. Can't say that word. Alliance. Is the marriage between the therapist and the client, if that is how well that's working, and the method they're using. Whether it's cognitive therapy, behavioral therapy, family therapy, or whatever. So you want to choose your therapist wisely. Get a good therapist and then be motivated to change. Try and be a good patient. Now, there's a whole section on when therapy harms. Sometimes therapists do more harm than good, and there's various things that therapists use. This is a little chart. 30% of therapists use hypnosis, and about 30% of therapists disagree with hypnosis, saying hypnosis is not a good technique. Age regression, that's when they say go back. You're going back. Now you're back in your childhood, something like that. When they think back to your childhood. Dream interpretation. that's sitting there asking you about your dream. How many of you say, I had a dream the other night, blah, 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 and the therapist would say, oh, that means this is in your life. A lot of therapists say that that's not a good technique. Looks like over 40% of therapists have some sort of dream interpretation work. Guided imagery related to abuse situations. What do you think that is?
I like the doll.
Yeah. Did you? Where did you see that?
It's in the book.
It was in the book.
Also,
Has anyone seen the movie Indictment? Good one. Y'all should watch that. Indictment's a movie about a therapist who uses some of this technique, this guided imagery stuff. She's got a doll, and she's saying to the kid, point to where your teacher touched you, and the therapist induces these children to tell the therapist that their teachers molested them. It's a true story. It happened in Los Angeles.
Wait, so someone is convinced.
What's that?
What was their motive behind it?
Because they thought one of the kids had been molested.
Oh, so they accidentally, like...
Yeah, the therapist did it without knowing she was doing it. She was using these techniques that brought these kids to say that they were molested, and they weren't molested. It was the technique she was using that brought it out. She was good at it and brought it, had these kids wanting to agree with her. And they arrested all these people and threw them in jail, and then they got beat up in jail because they were child molesters, and it's a bad situation. Great movie. Interpreting physical symptoms as evidence of abuse. That's another thing that goes on in that movie. Anyway, these are techniques that a lot of therapists say are not good and may end up doing more harm than good to some patients. Of course, they might help some patients too. So anyway, sometimes therapy can harm individuals, and you have to be careful of that. So it's somewhat of a long section, 6 pages. I guess that's not too bad. But read that, and once you finish the video here.
Can I stop recording?
Yes, you can stop.